Hello there, everyone. I'm Randy Murphy, epidemiologist and director of disease surveillance at the Mobile County Health Department. Today is Thursday, August 12th. I'm here with our public information officer, Mark Bryant, to give you the Thursday update of the impact of the COVID-19 pandemic on Mobile County visitors and workers. So today we're reporting on 55,475 cases of COVID-19 since last year. We added 659 cases yesterday. The total number of people who have died with COVID-19 is 908. 3 additional deaths were reported yesterday. The cumulative number of people hospitalized is at 6,911. 78 people were admitted to a hospital yesterday. So yesterday in the hospital, the number was about the same. It went down slightly. So luckily, there were a large number of discharges as well. 462 people were reported in Mobile hospitals yesterday. Wanted just to give a little bit more detail on what we're seeing in the past couple of weeks. This is in our daily report, so it's there for everyone to look at, but I don't often talk about it on Facebook Live, but I thought I would just mention today that if you look at the distribution of cases in the last 14 days by sex, most of the cases are in women, 53%, but most of the deaths are in men, 62%. When you look at the age distribution of cases, again, we're seeing 40% are 25 to 49 years old. 40% just in that age group. And then the next highest age groups are 50 to 64, 5 to 17, and 18 to 24. So all in that middle range between 5 and 65 years old. Now, there were 5% of the cases in the last 2 weeks were in kids 4 or younger. So that's a total of 352 kids, babies, toddlers that had COVID-19 in the last 14 days. And then over 1,000 children between the ages of 5 and 17 had COVID in the last 2 weeks. Luckily, no one under the age of 25 died in the last couple of weeks with COVID. And remember, 90, 95, 96% of all of these cases, hospitalizations, and deaths are in unvaccinated people. And if we look at race, it's rather interesting. So if you look at race, African Americans make up 27% of the cases and 23% of those who have died. And people reporting white as their race make up 29%, so just a few percentage points more than African Americans, but 69% of the deaths. So in the last 14 days, only 3 of the deaths were in African Americans and 9 of them were in people that identify as being a white race. All right, so there are lots of questions. Just want to remind everyone, it's never too late to get vaccinated. If you've had COVID, you need to get vaccinated. If you're pregnant, you need to get vaccinated. If you have underlying medical conditions, you certainly should get vaccinated. If you're older, if you're 12 and over, everybody should be getting vaccinated. The only reasons not to get vaccinated are if you have had a severe allergic reaction to any component of the vaccine. If you are at home on isolation and quarantine, as soon as you as soon as you get through your 10 or 14 days, go get vaccinated. Don't wait a couple of months after getting COVID or a couple of months after having a scare to get vaccinated. As soon as isolation or quarantine is lifted, go get vaccinated. Mark posted some links on the website that provide different types of information around quarantine and isolation. We talked about this yesterday, and I'll repeat it just to try to be as concise as possible, because the more you talk about it, the more confusing it gets. But we posted on Facebook a link to a one-pager, a CDC one-pager that talks about what is quarantine, what is isolation. Remember, isolation is for people who have COVID. If you have COVID, you go home for 10 days on isolation. Quarantine is for people who have been exposed or they've been around someone with COVID. The preferred length of quarantine is 14 days with a 10-day option if you're asymptomatic on the 10th day and you monitor your symptoms through 14 days. So there's a great one-pager that we put a link to, and then links to 2 quarantine and isolation documents from the Alabama Department of Public Health. So they're the ones that sort of make the rules and set forth the requirements for quarantine and isolation, usually adopting what CDC has recommended, adopting that for our state, and then Mobile County Health Department falls in step with them. There are separate quarantine and isolation guidelines for healthcare providers and everyone else. So if you work in a hospital or a long-term care facility or a dentist office or a pharmacy, then you are more considered a healthcare provider. You're more likely to be around people who are sick. So there are some added layers for you. But everyone else is, again, if you have COVID, then you stay at home for 10 days. If you've been around with someone for COVID or you live with someone for COVID, you need to quarantine for 14 days past your last date of exposure. So if it's someone in your office that got sick or someone at your church, then that's a little bit easier, right? You kind of know, okay, I saw them at church on Sunday. That's the last time I was around that person. So my 14 days starts Monday, right? That's kind of a clear-cut way of thinking about it. When it happens that way, it's easier. When it's complicated is when it happens in a household, or if it happens in a location like a daycare where kids are coming every day, or students or teachers are there every day. In a household setting, we just tell, if someone comes into our testing clinic and it's like, a dad and the sons, or a mom and dad and the kids, if anybody tests positive in the whole house, with the Delta variant being so contagious, we tell everybody in that household, okay, one person is tested positive, that's 10 days. Like, your last day exposure is their 10th day, because you cannot avoid being around the positive person for their 10 days at home. Delta is so contagious, it's really difficult unless you have, a mother-in-law suite that you can put someone out of the house. If you're still in the house, cooking together, eating together, packing lunches together, watching TV together, even if you're across the room, you're going to get COVID. You're going to get Delta. So if someone in your home tests positive, they have 10 days. They are potentially infectious for 10 days. So your last exposure is on the 10th day. Your 14 days starts then. So basically, the minimum time for combined quarantine and isolation for a household is 24 days. Minimum. All right, so those, the ADPH guidelines for healthcare providers, and then the guidelines for everyone else are on links to, and on Facebook. Yeah, linked on Facebook. And then I asked Mark to post a document that I dug out from the CDC archives. I think they call it Stacks. That was last updated last August, which is a little bit scary that I'm talking about it again a year later. But it uses a calendar and a couple of different scenarios to help you think through households that have COVID. Because what happens is one person gets sick, and then 7 days later someone else gets sick, and a few days later the sibling gets sick. And so it can go on, the length of time that house needs to be on lockdown can go on for quite some time. So when to start and end quarantine is posted as a document. I think it's posted as images on Facebook, and that can help you walk through looking at a calendar and talking through it. All right. I had a question yesterday that I said I didn't have the documents in front of me to answer, and that I would try to address that today, and it was about the use of ivermectin for treating COVID. So I want to answer that with an FDA consumer advisory that was published, I think, last May. This past May, not a year ago, May, but this past May. Says what you need to know about ivermectin. FDA has not approved ivermectin for use in treating or preventing COVID-19 in humans. Ivermectin tablets are approved at very specific doses for some parasitic worms, and that are topical or on the skin formulations for head lice and skin conditions like rosacea. So ivermectin as a tablet is approved for treatment of some parasitic worms, and as a topical formulation for head lice and some skin conditions like rosacea. It is not a drug that is used to treat viral illness. Taking large doses of ivermectin is dangerous and can cause serious harm. If you have a prescription for FDA-approved use, get it from a legitimate source. Never use medications intended for animals on yourself. Ivermectin preparations for animals are very different from those approved for humans. So to me, there is no room for interpretation in what FDA has said about the use of ivermectin. Don't do it. It is not for COVID-19. And it could harm you if you try to use it as it is not prescribed, or if you use ivermectin that is intended for use on animals. Okay. Feel good about having remembered to answer that today. All right, here are some media questions. Let's see. Someone saying at the news conference today at the infirmary, it was suggested by Mark Nix that it would be helpful for other agencies to assist in providing antibody therapies to help alleviate stresses on hospital capacities. So yes, the health department has been working with all of the local hospitals and with our state pharmacist in ADPH to try to encourage everyone who can to consider getting in the subcutaneous monoclonal antibody business, and that does not exclude the Mobile County Health Department. So this is not just something that you can kind of flip the switch and start doing it. It's not like the mall where we can just stand up doing, testing for COVID. I mean, a subcutaneous, I think it goes 4 doses here, each arm and each leg. It requires some intense monitoring. It needs to be in a healthcare setting, that sort of thing. So it's not something that, we can just set up overnight. But the health department is definitely looking at options for doing that, not only for ourselves, but trying to help, educate and inform and collaborate with other agencies that have the capacity, that have done infusions in the past, to maybe pick up that pick up that technology so that we can get it in more people in Mobile County that need it. Right now, the Mobile County Health Department does not have what's necessary for. We don't have the drug, and we don't have the nursing protocols, that sort of thing, in place to provide sub-Q monoclonal antibody therapies. But our Chief Medical Officer, Dr. Laura Cepeda, our Chief Health Officer, are certainly talking about it and talking to the manufacturers and talking to the state pharmacists to see if we would be able to build that capacity. All right, WPMI is asking about contact tracing on patients. Has there been any specific event or location determined to be a so-called super spreader? So yes, the Mobile County Health Department continues to conduct case investigations. And that includes trying to identify close contacts of cases. You can imagine that with 600 to 800 cases a day and the same number of investigators as we had in June when we were seeing 30 cases a day, we are not able to investigate all of the cases. So what we're doing is prioritizing investigation of people who have died with COVID and investigations of children who are too young to get vaccinated for COVID. So right now, our investigations are focused on 0 to 11-year-olds and people who have died with COVID. Now, there are super spreader events going on all over town. We hear about outbreaks all the time. People call us. We see in our surveillance system 2 or 3, people with the same address, churches, daycares, doctors' offices, lots of social types of events. So we know that they are going on all over town. but we don't have any, we usually don't share specific information or location about super spreader events, because doing that after the fact really has no, public health purpose. So when we do find out about employees or event organizers that have COVID in their population, we try to inform and educate them and guide them with the things to do the things that they need to do to stop the outbreak, and to inform anyone who might be exposed, to let them know that there was COVID at their event or at their location, so that they can stay home and protect themselves. So another question from PMI is asking about compliance with isolation and quarantine, and if there is any enforcement of these things. Quarantine and isolation were ordered under the Safer at Home order. So what the governor said and Dr. Scott Harris said in that order is that you shall follow the guidelines of the state health officer, and then the state health officer published those guidelines. So right now we still have requirements, but functionally it's more like a suggestion, because many people we know do not go home and quarantine, and that is contributing to our spread. If we were doing what we were told that works, our transmission would be going down, but instead it's going up. So we know people are not isolating and quarantining according to the state guidelines, and there is no enforcement of quarantine and isolation for COVID-19. It is a very rare event when the health department would issue, a court-ordered quarantine or isolation. That just is not something that happens. We don't have a public health or a health department police force to do that enforcement. So I do worry that people are not adhering to isolation and quarantine guidelines. Yes, 10 days or 14 days or 24 days for a household. It is an inconvenience. It's a hardship. You can avoid it if you get vaccinated. All right, Facebook questions. Someone asking, if children miss school for 24 days, what then? I don't know. That is between you and the school system. So please, get everyone in your household vaccinated so that you can avoid the situation of having an entire household that has to lock down for a very long time. Several questions about needing to stay at home and employers not paying. So last year there was a provision for emergency COVID stay-at-home pay, and most businesses and locations were able to continue paying employees that had to stay home because of a COVID diagnostic, a COVID diagnosis. But we have a safe and effective vaccine now that can prevent you from having to stay at home. So employers are not able to pay like they could last year under emergency orders when we had no vaccine. So I understand that it's a long time for parents to be out of work. It's a long time for kids to be out of school. But again, we have prevention measures now that can help you avoid having to quarantine or isolate for a long time at home. Get vaccinated. Get everyone in your household who's eligible vaccinated. If you're vaccinated and you're exposed, you don't have to stay home. Simple as that. I realize that young kids can't get vaccinated, but the more people are around them that are protected, the less likely they'll be to get COVID. Someone asking me about treatments in addition to monoclonal antibody treatments, other treatments like hydrochloroquine and ivermectin. This is their comment. Shouldn't those be increased? Because they are not FDA approved. The data has not, or authorized, right? They've not been authorized for emergency use. They have no standing with the FDA with regard to use for treatment of COVID-19. So that's why we don't recommend them. We recommend things that FDA has seen enough data and enough proof on the safety and effectiveness that FDA gave it, emergency use authorization. Let's see. Lots of questions about when are we going to get the disaster under control. I don't know. I've looked at some models that say that we may get back to what we saw in June, where we were in June. We may get back to there in late October. But if we don't, between now and October, if we don't get 70-80% of our population vaccinated, then come October, we may have a couple of weeks of of exhale, and then have another variant pop up, and we may be back where we are if we don't get people vaccinated. Let's see. People asking about the fact that if you're vaccinated and you get exposed, that you don't have to go at home. You do have to wear a mask and test every 3 to 5 days. Again, we're trying to, these are often difficult decisions, right? We know that people who are vaccinated will be protected from hospitalizations and deaths. But we still need people to be able to work in hospitals, work in long-term care facilities, work in schools. So that's part of the reason why we say we just try to balance the risk and benefit. So right now, that's why we're saying if you're fully vaccinated and you're exposed, you don't have to go home and sit out for 2 weeks, but you do need to wear a mask and get tested so that if you do get asymptomatic infection, then you can go home and get yourself out of circulation. Someone saying that New Orleans schools have COVID testing at each school and are doing contact tracing. Is that happening in Mobile? Not that I know of. We've had some discussions about testing in schools. Most schools were reluctant to implement screening testing because even if it was just voluntary, because they felt like it was going to be fairly complex to implement, and it is not easy. Or they thought it was going to be, hard to get parental consent. Their nurses are already over. A lot of reasons why there was resistance to doing it. What we have said to the schools is that, okay, we hear you, it's your decision. But when you start seeing a few and then a few more and then a few more COVID cases in the school setting, you need to start testing everybody every 3 to 5 days, because kids usually don't get sick, too sick. And if you don't test to identify who has COVID, your outbreak can just go on and on and on and on. So in an outbreak setting, we have really encouraged them to contact us to get our assistance or let us help them get testing in the schools for all students, teachers, and staff every 3 to 5 days until they are COVID-free for at least 14 days. Because if they aren't identifying people who have COVID and excluding them from school, the outbreak's just going to continue and continue. Any new information on getting vaccinated for nursing women? No, there's no new information. The information is get vaccinated. There's no reason to defer vaccination because you are a new mom or a nursing mother. In fact, there are some studies to show that you may be able to pass some antibodies on to the infant, which would protect them, give them some protection. We don't know how much, but nursing your child is not a reason to defer vaccination. Someone saying if a son is vaccinated and the mom is vaccinated in the same household and the son got COVID, what do you do? So if the son is vaccinated, it doesn't matter if you're of your vaccination status. If you get diagnosed with COVID, you have to stay home for 10 days. If you have COVID, stay home for 10 days. If other people in the household are already fully vaccinated, they don't have to stay home, but when they go out, they need to wear a mask and they need to distance themselves and monitor their symptoms for the 10 days of his stay at home, because he may be infectious during that, and then for 14 more days. So 24 days total for a vaccinated household member. Wear your mask, get tested every 3 to 5 days. So here's, the last bullet here is about this finger pointing that happens when, some politicians say it's the health department's, purpose, or they're the ones who can do a mask order, and the health department says we can't do a mask order. We don't make laws. We don't have enforcement abilities. We can make extremely strong recommendations about a mask order, but in the municipalities, it's the municipal governments that have the power to issue mandates and curfews and restrict, strict attendance at events and limit occupancy and all of that. So the municipalities are the ones that run those cities, and those governments can make those kind of decisions, and they have enforcement components to their government that would allow them to enforce those orders or curfews or mandates. All right, so I think that's about all for today. Yeah, so Mark says there's another long list of questions. I can tell that I talked yesterday about 24 days because a bunch of questions from yesterday were about the 24-day for your household. I know it. We're trying to boil it down to something that's easier for people to sort of have to digest. Hopefully you're getting these consistent messages when you get tested by us that if you test positive, you go home for 10 days. If you're exposed, you stay home for 14 days past your last exposure. So I will stop there. And I did want to mention, just again, I've been sort of giving you updates about how things are going at the old Forever 21 in the mall that we call COVID-21. So yesterday, we had another red letter day at the mall. It's going really well there. We tested 540 people. Around 20% of them were positive. So that's just a remarkable feat, I think, for us in this little pop-up clinic with just the sort of small staff that we have and some rental chairs and tables from our vendor Blue Rents. So the folks over there most people there are extremely patient. Some people are waiting, an hour to get tested because the volume has just been so high. So I appreciate everyone's patience, really appreciate the staff who are working there, very long hours, testing, hundreds of people every day. We also gave 139 vaccines there yesterday. So making this decision to close down our New Bern clinic and to stop doing so many community events has really paid off, because our collective number of people who are vaccinated each day is much higher now than it was when, before we opened the mall. So we're just really proud of that effort and appreciate everyone's patience. Most people who come there, even though they've had to wait, it's still, they're very grateful for, results while you wait, and walk out with your test results, and appreciate what we're trying to do for the community to try to slow spread by identifying people who have COVID and getting them at home where they can stay so that they stop spreading COVID around the community. So just wanted to mention that. Thanks to everyone at COVID-21 who's working hard out there, and all of our clinics at the Mobile County Health Department and Family Health. We still have a Monday through Friday COVID clinic at our Keeler location, and all of our family health, all of our clinical sites are working to be able to provide, increased testing capacity, increased ability to give vaccines. So we're just so proud of everyone around the MCHD family and family health services, family that are helping us try to protect our community. So stay safe out there, everyone, and we'll talk to you on Finally Friday tomorrow.